This is an Andy's Randomness special report. Reporting now, Andy Pollock.
Good afternoon, everyone. Andy Pollock live again from the Random Studio in Fresh Meadows, New York. This is for my Delmarva viewers. I haven't forgotten about you guys today. So, right now we are waiting to hear from Delaware Governor John Carney. He will be giving an update shortly at 1:45. We are going to go live to the feed shortly if we can join in to John Carney. Also, while this is playing, I'm going to go on LTE and see if any Delmarva affiliates or any Philadelphia affiliates are at least interrupting. Okay, good. So, they are waiting for Governor Carney to come on shortly. So, to make you aware of what Delaware is going through right now, Delaware is, of course, going through a very rough patch right now. I can tell you this right now. We're seeing a lot of cases in Rehoboth Beach. I've been getting reports from there, from the health department specifically. They do have their own health department in Rehoboth Beach.
I'm Governor John Carney.
Oh, here we go.
And I'm here for our press briefing, our update on Delaware's
So we're going to go live to Governor
COVID-19
Carney right now.
Outbreak in our state. I'm here with the Director of the Division of Public Health, Dr. Carol Rotte, who you're going to hear from in a moment, and our point person in our emergency response, A.J. Shaw, who's the Director of the Delaware Emergency Management Agency. I want to thank both of them for their work over the last several weeks, tireless work with their teams from public health and from the emergency management agencies in our state, our local partners. In particular, thanks to our hospital partners. We had our couple-day briefing earlier this morning, conference call with the hospitals. We're making progress with respect to the information that they provide us for our planning purposes with respect to our partnership around testing, our protocols, the number of the equipment that they have to carry out the tests. And most of the reports that we heard this morning were very positive. We just appreciate so much their work. Obviously, the tremendous work of the frontline healthcare workers in the hospitals and healthcare facilities across our state, those who are working in nursing homes and long-term care facilities, a critical activity through this pandemic, protecting the Delawareans who are most at risk here. And I'm going to start with a brief update, as I do with each of our briefings, in terms of the number of positive cases, which continue to grow, the curve that we're seeing, the surge of additional positive cases and hospitalizations and recoveries. It's that bottom number of the hospitalizations that direct so much of our decision-making, the decisions that we make in conjunction with the hospitals and our partners in terms of alternative care sites, which AJ is going to talk about, and in terms of our activities to reduce the spread of COVID-19 in our communities with restrictive orders that are part of a state of emergency declaration. So as of yesterday, the number of total positive cases has grown over 1,000 to 1,116, 19 deaths to date, 177 hospitalizations, and that hospitalization rate, the number of hospitalizations compared to the positive cases, is one that we track because, as you'll see in a minute, with respect to our predictive models and our projections, that hospitalization rate is an important one to track. We've had 159 recoveries. We don't talk as much about that, but that's a real thing happening across Delaware. So how does it break down by county? 636 positive cases in Newcastle County as of yesterday. These numbers will be higher today, of course. In Kent County, 201 positive cases, and in Sussex County, 279 positive cases. It's important to point out two things, I think, now with respect to the testing and the positive cases is the test results, there's a lag. That lag has gotten with commercial labs doing testing the results, has been a lag of as much as a week or 10 days. The reports on the conference call this morning was that the turnaround time for those test results was down to 3 to 5 days, which is a very positive, development, as well as the fact that Christiana Care now and increasingly Bay Health will have the ability to do the testing results in-house and be able to turn those results around the same day. And that's a really positive development for the purpose of managing patient care instead of holding individuals in the hospital necessarily as a potential positive case. They're able to treat them differently and manage the caseloads a little bit. So how does the number of cases, positive cases, break down by age? You can still see that very few of the positive cases are the younger infants and children up to age 17 there, and only 26 total across our states, only 6 of which are infants to 4 years old. So the bulk of the positive cases are in that middle age group from 18 to 49, I guess broader than what most people would consider middle age, and then the populations that we focus on protecting the most just because of the risk to a fatal condition is 65 years and older. All of our 19 deaths so far have been in that population. I'm looking at Dr. Rattay. She's shaking her head yes. And in most instances, they've been with individuals who have had pre-existing bad health conditions, chronic disease, or the like. So the next chart shows you the graph, the slope of the increase that we're looking at over the next 2 weeks. This takes us out to April 14th, not quite 2 weeks. The purple bars at the beginning from March 31st up until yesterday are the actual numbers for hospitalizations or the number of cases at the bottom, hospitalizations at the top. So yesterday, again, was 177 hospitalizations and 1,116 cases. That's a 16% hospitalization rate, 16%. So it's 177 divided by 1116. And that's relevant to the charts in terms of the projections, which ramp up, which basically assume a 20% hospitalization rate to be on the conservative side. So those numbers you see there are based on that. And then the projections for the increase in number of cases increases from about 15, a little over 15% to 20% there, April the 14th. So we're seeing the surge, the increase in the number of positive cases. This is a function both of the number of tests that are done, individuals who are recommended to have a test because they are symptomatic, they've contacted their primary care physician or the helpline numbers and have been referred to one of our 7 testing locations, which are managed and operated by the hospitals in each of the 3 counties. So we continue to use these numbers, particularly that hospitalization rate, to make our decisions in terms of standing up our alternative care sites and helping the hospitals manage that surge and provide critical care, including ventilators, which is life-saving care for those individuals who need it. The next chart just is a summary of our amendments to the state of emergency declaration. And we talked about all of these yesterday, April the 6th, we had the most recent amendment, which included a banning on short-term rentals and hotels, motels, except for exceptional cases, which we're working through that. It also provided guidance with respect to the appropriate measures that need to be taken by businesses that are still open. We do have, and Dr. Rattay is going to talk about this, a recommendation for individuals who, first of all, the order is still in place to stay at home, stay safe, observe appropriate hygiene, personal hygiene, and social distancing. But when you do go out for essential activities like going to the grocery store or the doctor, we're encouraging Delawareans to wear a face covering, a cloth mask, and Dr. Rattay will talk about that. There is some nuance here that you need to pay attention to. We're not asking you to use a surgical mask because we need those for the healthcare providers and the like. And this is mostly about protecting others from, infection that you might have as opposed to the other way around. Dr. Rattay will talk about that as well. But the details there are important. AJ is going to come on in a minute and talk about our surge capacity, in particular our work with our partners up and down their state, and Dr. Rattay is going to talk specifically a bit about the outbreak that we've had in the Delaware Psychiatric Center and some of the concerns there. Some of our new testing capability will help us monitor those facilities better with the quicker turnarounds and the rapid testing. So with that kind of as a level set, I'm going to turn it over to to Dr. Rattay, who will talk about the cloth face coverings first.
Great.
Dr. Rattay.
Thank you, Governor. So over the weekend, the CDC issued guidance regarding the use of face coverings. And yesterday, the governor issued guidance that we prepared for Delawareans. So consistent with the CDC guidance, we do recommend wearing face cloth coverings in public settings, especially in places where social distancing measures are difficult to maintain, like a grocery store or a pharmacy, and for some people in their essential workplace. We want to be clear that this is a recommendation, this is not a requirement. We also really want to be clear that this is not a substitute for existing guidance around hand washing and social distancing, which are so very important. The best defense against COVID-19 is frequent hand washing, avoiding being around sick people, staying home, physical distancing, and avoiding touching your face, your eyes with your hands. If face coverings aren't used well, they actually may increase the risk of contracting COVID-19. So again, it really is important that when people use them, they don't touch them. They put them on, they keep them on, and then later take them off without touching the front of them. And once taking them off, wash their hands really well. So members of the general public are not recommended to use medical or surgical masks, as the governor mentioned. Those really need to be reserved for healthcare workers, but there's a lot of people out there looking at creative ways, making creative masks. As long as it's a tight-knit fabric, there's a lot of different options out there, and on our website we can point you to different ways to make a mask out of a t-shirt or a scarf or other materials. There is limited evidence to suggest that the use of a cloth face covering during a pandemic can help reduce disease transmission. It can reduce the release of infectious particles into the air. So what's important here is when you wear one, make sure that it covers your nose and your mouth. We're seeing people with them on their chins or not completely covering the areas where infectious particles can be released. We also want to make sure that people have a good understanding of how you use it. I already talked about don't touch the front of it once it's on you. Once you have removed it, make sure you wash your hands, but you also want to wash your cloth face covering at least once a day, ideally after each outing or each use. And there are some settings where you're going to see more and more people in the workplace. So, for example, in healthcare settings where people aren't delivering direct care, you'll be seeing more cloth face coverings, as well as in like childcare settings. Not for the children, it's especially young children, not safe, but for child care providers, we are recommending that they wear these face coverings around children. So again, the primary purpose of wearing a face covering is really not to protect yourself, but it is to protect others. So let me talk a little bit about the Delaware Psychiatric Center. We have 5 patients and 3 staff members who have tested positive for COVID-19 at the Delaware Psychiatric Center, which is the public psychiatric hospital on the grounds of the DHSS main campus. The patients are isolated within a unit at DPC, and staff members are self-isolating at their homes. Now, this outbreak was identified through the use of rapid test kits that we talked about receiving last weekend. So as we mentioned, these rapid test kits can help us identify outbreaks in facilities. DPC is the 7th care facility in Delaware to report positive COVID-19 cases, and 5 of these facilities have multiple cases. The DPH and our sister division, the Division of Healthcare Quality, are working closely with long-term care and other licensed facilities in the state to verify that there are strong screenings and infection control and isolation measures in place in each facility. And if not, we want to assist them in implementing stronger protocols. We are very concerned about the patients at all of our state's long-term care and licensed facilities, as they are among our state's most vulnerable populations. We're also equally concerned about the staff who care for them and are working to ensure that they're aware of and implementing all relevant infection control protocols as well. Let me talk a little bit about testing. At our DPH lab, we have now tested a total of 1,670 samples. Among those, 254 are positive and 1,416 are negative. I also want to mention through the hospital community testing sites, we actually have over 10,912 samples that have been collected and tested at those sites, which is really great that Delawareans have had access to this level of testing. And finally, I want to touch base on racial disparities. This is an aspect of this outbreak that has me, as well as Dr. Walker and the governor, concerned. Now, we've looked at our data, and one thing that we have found is that for a number of our, in fact, almost half of our laboratory samples do not have race or ethnicity designated on those samples. And so a very important measure for us going forward from this point on is a requirement that any provider who is ordering COVID-19 tests must include race and ethnicity on that laboratory ordering form. It is critically important to us that we be able to have a good picture of what is happening in our state as it relates to racial differences of COVID-19. Now, many states have seen significant disparities, especially in their death data. In Delaware here, 16 out of 19 of our cases are white Delawareans and 3 are Black. So at this point, our data don't mirror what some states are seeing, but we certainly have reason to be concerned. In general, and among our minority populations, the chronic diseases that put people at higher risk for serious consequences of COVID-19 tend to be higher among our minority populations, like diabetes, high blood pressure, cardiovascular disease, and asthma. So therefore, it is critically important that we keep an eye on our data, but it's also really important that we do all we can to intervene and reach out now. We know that many people of color live in locations, in housing situations where it can be difficult to social distance. We also know that we have higher numbers of minority populations or percentage of individuals who are working in the service industry, which in many cases are essential service providers right now. So as I mentioned, reaching out through existing coalitions. We have a number of partners who are working hard with minority populations to address needs in our state. Is a really important avenue for us to make sure we can do all we can to support minority populations. Through our Healthy Communities Delaware initiative, we're working with the highest risk communities across the state, and several of them have already put plans in place to better reach out to members in their community around COVID-19, whether it's testing or wraparound services. Also, the Delaware Community Foundation is operating the COVID Strategic Response Fund and reviewing applications from organizations working with these communities for issues related to COVID-19. And finally, I want to mention internally, we've sought flexibility from our federal partners to make sure that Medicaid and social services can quickly deploy benefits to people in need and keep people on their current benefits. With that, I'm going to hand it back to the governor.
And I'm going to ask you a quick question, if you could describe briefly, you talked about, and the slide here shows the DPH lab test results with 1,670 total tested with 254 positive. If you could just explain, there's a certain protocol that you have, I think, for the testing as it fits in with our statewide testing that's done mostly by the hospitals. You mentioned over almost 11,000 tests with the hospitals. Just talk briefly about what the protocols are for testing from the state lab, if you would.
Yeah, so across all the protocols, only individuals who have symptoms of COVID-19 will be tested. Now at the DPH lab, we're testing our highest priority individuals, so individuals for whom we have the greatest concern, whether it's individuals who are hospitalized, chronically ill, first responders, healthcare workers, people in facilities like we have talked about. So most of the DPH lab tests that you see there are among those highest priority groups, because we have over the past month, 6 weeks or so, been able to turn our tests around faster than anywhere else. Now the hospitals are starting to gain their own in-house ability to do testing and to turn it around quickly, but through the community testing sites, they've been sending out these labs to commercial laboratories, which I think some of you may know at times have taken even 10 or more days to get results back, but those results are coming back much more quickly now. As the governor said, we heard earlier today, about 3 or 4 days.
Yeah, and important to point out too that our efforts to assist Christiana Care through developing and producing reagent right here in our state, that they're able to do their testing in-house and turn them around, as I understand it, in the same day, as opposed to waiting for days to get those results back, and thereby allowing them to manage those patients in a more efficient and effective way. AJ, you've got a stack there as well.
Thank you, Governor. So the governor led off with some of the projections we're looking at, some of the numbers we're keeping a close watch on, and what we're looking at now is really the hospitals. How healthy are they now, and what could they handle before we need to provide some assistance? So he talked about the 20% benchmark. We're a little bit below that right now. We feel that we'll get up to maybe about 500 hospitalizations in about the next week. This is going on those same type of assumptions. Right now, the hospitals have a relatively low census, so they've canceled elective surgeries. They've seen a decrease in emergency run volume, as we heard from Chief Logerman from Newcastle County EMS the other day. So that is good for us. That means as we get more positive tests, as more people need to go to the hospital, they have that capacity. However, we're working with the hospitals across the state. Just yesterday and Tuesday, the National Guard worked with Nemours and some individuals from Christiana Care and some public safety partners to go through some dry runs of how they will utilize the alternative care site up at Nemours Hospital. Great partners across the board with St. Francis, Nemours, the VA, and Christiana that we've seen up in Newcastle County. We have that same type of relationship down in Kent and Sussex as well. As I'm talking about preparing for this, I think we also have to take in mind and look at what the weather's like outside today. Last week was our severe weather awareness week. We're looking at high winds today. So people, we just can't be focused on the COVID. We know it's a big risk and we need to prepare for it, but we also have to make sure we prepare for other things as well. As it was just over a year ago that the community of Laurel was woken up very early by a tornado. So great partnerships as we plan here for the northern part of the state and the southern part of the state. The hospital communities are driving that themselves. We're providing assistance as needed, and it's been a great partnership. So as we talk about partnerships are going to help us succeed and get through this by providing the needed services to our citizens. This week, with the help of Public Health and United Way, who runs 211 for Delaware, we utilize that to kind of be that initial contact point for individuals that had calls to the state, whether this was related to a public health issue, they'd get them to public health. If it was a call about unemployment insurance, or if they needed assistance from one of the many partners that work with meal deliveries or stuff like that, they get them over to the appropriate partner. So a great partnership there, and we appreciate United Way for their partnership and their ability to flex in the state. Food Bank is another one. Food Bank had a few pop-up drive-through delivery services over the last few weeks. I know they're working with more, but again, here we are. Individuals have lost their jobs, lost incomes, kind of that stability meal is a concern on a lot of people. The Food Bank and these other groups have definitely stepped up. National Guard is going to be assisting them with some drive-through services later on this month as well. So a win-win there for everybody. Dr. Rattay talked about the Delaware Community Foundation. Again, neighbors helping neighbors, we talked about all the time here in Delaware. $350,000 awarded already to 11 nonprofits across the state. And Stu and his team are doing some great work over there to really help bridge the gaps from some of these unmet needs or unanticipated financial needs that some of these nonprofits would need. And then really just to close, I think we said this the other day, but we included here something that was pretty exciting. A friend of mine from the fire service sent this picture the other day. Bay Health Fire Service down in Kent, Sussex County went to the new Bay Health site in Sussex to show their appreciation for the healthcare workers. I think we talked about that the other press conference, but we know the healthcare workers are on the front line. You talk about the stress and the anxiety that we have. Just multiply that for those that are going into these hospitals, kind of waiting for the next shoe to drop. We are doing everything we can to support them, and I think it is great here seeing the our public safety partners in Sussex County to show some outreach to them as well and show their appreciation. So we said it before. I know the governor's going to close here in a second, but we have to help ourselves. We have to stay indoors. We have to make sure we have distance between us when we're outside, and that's going to be what helps us reduce the stress off of our healthcare workers and public safety workers. Governor.
So thank you, Director Shaw, and I'm going to open it up in a minute for questions, the media that's gathered here, and we've taken some questions online that we'll address as well. First, I'd just like to make an observation, and that is, as I woke up this morning and maybe before going to bed last night, I noticed that a report from the Institute of Health Metrics and Evaluation at the University of Washington, which is a model that's been used to predict the surge and the peaks in various places across our country, said in their most recent version with changes to their model or data based on a situation on the ground, that the coronavirus peak here in Delaware has already passed. Well, that is just not true. The projections that we have and the report from today is that the number of cases has increased again from 1116 to a number much higher than that. We don't have the final number in, and the hospitalization number will jump as well. That hospitalization number, based on our experience in the past, has been around 15% or thereabouts of the total positive cases. Our projection going forward is that it will follow a 20% rate of those positive cases. And so we continue to see the positive cases going up. We know that we're doing more testing, so some of that is a function of doing more testing. The results that we get back have been a little bit lumpy because of the delay in getting results from the commercial labs. Now we're going to get results more quickly from the hospitals themselves who are doing those tests and processing those tests, and also from our public health laboratory. So we still have a lot of work to do. to prevent the continued spread of the coronavirus here in Delaware. And so our message today is the same that it's been for weeks now, which is stay at home. We have a stay-at-home order in effect. This is a religious holiday weekend, Passover starting last night, and Easter celebrations through the weekend, and we would ask everyone to observe the directives of the order and to celebrate and commemorate these religious holidays and traditions, but do so in a safe way with your families. Continue to practice basic hygiene, hand washing, making sure you're wiping down surfaces that are utilized a lot. Protect your neighbors by avoiding going out of the house except for essential activities, which includes a nice walk in the fresh air by yourself or with somebody who's 6 feet apart. Your actions affect your neighbors, and your neighbors' actions affect you, and we'll be able to save lives if we're able to do that together. So I want to wish everyone a good holiday over the weekend, and we'll take some questions from the media now. Esteban
Parra, the News Journal, Delaware Online. Governor, thank you. Based on
Okay, so once again, you were just listening to Delaware Governor John Carney give his COVID-19 briefing. Now, at the moment, we do not know if Maryland Governor Larry Hogan will be addressing Maryland today. I don't know if Virginia is giving an update today, so I'm just checking right now. I haven't gotten anything from WRIC, so they would have told me something, or most likely I would have gotten the notification from the Maryland governor's office, and they would have told me if Larry Hogan was speaking today. So once again, you heard the governor pretty much being upfront. The main takeaway was this is not the peak in Delaware. We are going to see the cases in Delaware get worse and worse and worse within the next week. I still think there's going to be 1,000 cases statewide, and I will do a quick question. Siri, what's the population of Delaware?
In 2015, the population of Delaware was 945,934.
So that's very concerning because it's a small state, and yet there could be 1,000 people sick from COVID down there. So, very quickly, I have my Hulu app here, and I had the geolocations at the Delmarva. So can I check to see how we are doing in the affiliates?
We've heard on these calls where they've put in charge
Okay.
a Navy.
I know WMDT was not interrupting, which, shame on them. You know, they should not be airing regular programming. They have a translator in Dover, an over-the-air translator. I don't know why they just can't interrupt regular programming. I'm just checking right now. Yeah, WBOC is still on the air, which I gotta give WBOC a lot of credit today. They're covering it still.
So, no, I think the governor did a good job.
I also mentioned WRDE is covering it today. So that's pretty good that you have most of the affiliates covering it, except in WMDT's case, which I don't even know why Channel 47 can't interrupt. You know, that's why I don't bother watching them. Because they have a terrible news. I mean, I can respect the fact that in Delmarva there's a proper ABC affiliate, which I'm glad about that. But, you know, they just don't have a good affiliate down there. Unlike ABC 6, which is an owned and operated station, they're actually covering John Carney today. They're actually covering John Carney in Philadelphia. So, that's a big deal today. Very big deal. So, I'm just checking right now. Yeah, I think with that, I think we're going to wrap this up. I mean, you saw the press conference, so... Well, this is a briefing, but still the same thing, so... I think with that, we're going to leave the air. So, I'll be back tomorrow. More stuff. More important information. So, thank you for watching. This has been an Andy's Randomness special report.
This has been an Andy's Randomness special report.